Welcome back to our session. Um, if you recall before, we were going over your treatment plan, and one of our goals was to, kind of build up your coping skills and build on mindfulness. Do you know what I mean about mindfulness? Have you ever heard that term before?
Heard of it, but I don't know what it is.
Okay, well that's great. I'm glad that you've heard of it. Essentially, what mindfulness is it's a way that we can improve our well-being, emotional reactivity. Can improve symptoms of anxiety and depression, as well as um, improve our attention. A few people kind of describe it in a way as, you know, paying attention to our bodies in a very specific, mindful way, um, to really ground ourselves in the present moment. Okay, so um, I'm going to show you two mindfulness techniques today. The first one is belly breathing. It's a deep breathing technique, which can help us, you know, kind of analyze how our body is feeling and get us away from ruminating on any negative thoughts. Okay. Um, Another really great thing about mindfulness is, it's great on its own. However, it's really effective when it's paired with behavioral changes. Just like in our intervention plan, it's going to be paired, the mindfulness with behavioral changes. Okay, so the first one, the deep breathing technique, if you could put one hand on your stomach and one hand on your chest. Okay, and as you breathe in your nose, you're going to, think of it going in through your nose, down into your body, into your stomach, and extending your stomach out. Okay, so try it with me. Try to push your stomach out as far as you can. You know, stay in your body with that, and then breathe out through your mouth. And just, being in the moment with it. Any any thoughts that come in, just let them pass. Okay? How did that feel?
Good.
Yeah. It's best to do it a few times throughout the day, probably a total of, 10 or so minutes. You can split that up. Um, and so the second technique that we're going to do is it's a grounding technique. Um, and so this, again, can try to pull us away from those negative thoughts and ruminating on those, um, and really bring awareness to, what's going on around us. So the one that I'm gonna show you today is called the 5 4 3 2 1 method. This is one of my favorites. It's 5 things that you can see, 4 things that you can hear, 3 things that you can touch, 2 things you can smell, and 1 thing you can taste. Okay, so we're gonna start with 5 things that you can see. If you could just either name those off or think of them in your head when you're ready to move on.
Fan, cup, glove, box, pants.
Okay. And now 4 things that you can touch.
Self,
Mm-hmm.
TV, speaker, phone.
Okay. And now 3 things that you can hear.
Fan, ventilation system, and my own voice.
Okay, that's great. And now 2 things that you can smell.
I just cleaned, so cleaning product and
Yeah, this one, it can be kind of tough. It's especially with the smell. Um, Something I like to tell other clients is even, if like smelling your shirt, or, if you have deodorant even, or a cream, smelling that could work. Okay,
deodorant.
perfect. And now the last one thing that you can taste. This one, again, can be pretty hard. So, you can even,
The dinner I just ate.
okay, perfect. And if at a later time you're trying this and you can't think of anything, you take some water to take a bite of a snack or anything like that. Okay. And so, how did that one kind of make you feel?
I just get my mind focused. So,
Yeah.
so, yeah.
Yeah. So, mindfulness is really um, just a really great technique to pay attention and purposely be in the moment, right? And so, mindfulness can also give you a greater sense of control, increased self-awareness, greater sense of calm, peace, happiness. And so it's really great, maybe in your case, as you are, dealing with those feelings of guilt, if those become overwhelming, practicing mindfulness. It can be great. It's really beneficial to practice every day and pair that with the behavior modification that we have been talking about, right? Getting, better organization with our academics, as well as, carving out that personal time for yourself, as well as with our family, right? Okay, so I think, you know, I hope those techniques work for you, and I'd like you to journal them every day, okay, for about the next month. Okay?
Sounds good.
All right, awesome.